Hello, I'm Rocky Chapin, President of the Benedictine Health System, speaking to you from our Shoreview Support Center, and I bring you greetings on behalf of the Board of Directors, our sponsors, and all the people who work on your behalf. There's a lot of challenges going on in our industry, and I'm going to talk a little bit about those, and I'm also going to talk about the kinds of things that we're doing at Benedictine Health System to meet those challenges that we face and chart a course going forward. Another thing that's going on these days is State of the Union addresses. Governors are giving them, the President's going to be giving one soon. And so a little bit of my conversation with you today will be our State of the Union. First is, we are not dying. We are not stagnating as in our worst fears we might want to believe, as things look so tough for us. We have finished the first half of our fiscal year in bad shape. We have significant losses from operations. Our investments haven't done as well, as I'm sure if you look at your 401k, you'd see the same thing. And so there's a challenging time for us. Now there is hope on the horizon coming, and that's called the Minnesota rate increase and the cost-based reimbursement system, and that's going to significantly help us. But the fact is, we are not just letting it all wash over us. We are taking some steps that we think will fundamentally change our future and change it for the better. The first is, I don't think a lot of people are aware that we have over $92 million of investment happening this year. And I'll just go through a list of those kinds of things that speak to our transition from a skilled nursing focused organization to one that's going to be broader based and serving more people in more settings. We'll start with the fact that we opened this month in Madonna Towers, the memory care assisted living unit, 16 beds. We also are opening in March an assisted living, independent living, and memory care unit in Byron, Minnesota of about 50 units there. Down in St. Louis at the Nazareth facility, we have $42 million worth of investment going in. We are doubling an independent living complex from 50 to 100. We are putting in a 48-unit memory care unit, assisted living, and we are spending some money on renovating the skilled nursing into a transitional care unit to respond to the needs of that market. St. Gabriel's out in Bismarck, North Dakota, we have a significant investment there, $18 million to add 90 units in mostly assisted living and independent living for seniors on that campus, where we already have a fairly large skilled nursing facility. And at St. Bridget's in Red Wing, you recently announced the replacement of that skilled nursing facility with an emphasis on transitional care there. We have a number of other projects in planning, and they share this common theme. It's about renovation to meet the needs of a new and demanding customer, those we serve, as well as focusing more on assisted living and independent living. We are also in negotiations to purchase a home care agency because we believe that's another part of our future. As I mentioned, our financial situation is troubling for us and a big-time challenge. Driven by a number of factors, not the least of which is a drop-off that we've seen recently in our transitional care, where hospitals are transferring people not to us for rehab, but to home and to outpatient therapy or to home care. That's a significant shift, and one that, quite honestly, we did not anticipate even 2 years ago. And so that has created a challenge for us. What we are doing on that front is working to become partners, to be better partners and not just vendors with those accountable care organizations or those integrated health systems. The other thing that we're seeing is simple demographics, and we've talked about it before, but there are a lot fewer people born in the 30s, those who would now be starting to seek services outside of their home. And there's just a lot fewer people born in the 30s than there were in the 20s. And so we built our capacity in skilled nursing particularly for those numbers of people born in the 20s, and so as we are discharging people or they're going to their maker, there's not people to fill in behind them. Couple that with the fact that there's a lot more alternatives for people, and so we're seeing people seek out assisted living in cases where in the past they would have sought out skilled nursing care. That's a pretty significant change in us, but I think it's one that we have addressed. The $92 million, as you see, is mostly in those kinds of settings that people have expressed a desire for and are voting with their feet on. For our Minnesota communities, we've received a great bump, if you will, from the state legislature in moving to a cost-based reimbursement system for our Minnesota facilities. That has allowed us to, on average, increase salaries and benefits 13.2%. That's a huge jump. In some of our communities, it's up over 20%. In some of them, it's only 3 or 4. We're planning for 2017, starting right now, fiscal 2017 with our budget, and we're looking at 2 key initiatives, if you will, or 2 key guiding thoughts as we go forward. We need to plan for fiscal 2017 as if we were the provider of choice in the community and the place where the best want to work. 2 simple ideas. We need to be really competitive, because as the market's going down, we need to have a greater share. And so a lot of our preparation for budgeting this year is looking at who do we compete with, what services and amenities do they offer, do we compete with them well on quality, and if not, how do we improve our quality? But we need to be the place where people want to be discharged to from the hospital or admitted to from their homes when they need care. That's a significant step for us. The second initiative, or the second idea, that we want to be the place where the best want to work has to do with making sure that we provide efficient ways of onboarding people, recruiting them, of training them, of providing a career path, and there's a lot of work being done on that, including more regional support for those efforts. You're going to be hearing more in the months to come about improvements to our eSource intranet and our websites that'll make it easier for people to apply. And we think that's going to help. We're going to have more consistent onboarding, and we're making progress, we think, on creating training and development that will allow people this sense of opportunity, and they'll want to stay with us. Mission and value surveys are wrapping up today, and we are going to learn from them, just as we've learned from the past, and we expect that we will make some changes in rolling out some of the things that I talked about in response to those surveys. If there is a theme, I'd like it to be this. We're hearing you, we're listening to you, we're understanding where you're coming from and what your needs are, and we hope to meet those and turn it around. For many of us, this feels like an end of an era at BHS as we go through the significant changes that I just mentioned, as well as the leadership changes that are occurring now. Bobby Goodry left us to join the Leading Age Association and lead their Housing and Housing with Services section. Diane Vaughn has left to join Volunteers of America for some very personal and professional reasons of her own. Dr. Paul Sanders has retired, or will be retiring on April 1st. Dr. Neil Budenseek is taking his place. All of these changes would suggest that, oh my goodness, there's great change. But you know what? With great change comes also great opportunity. We passed times like this in 2000 and 2004, 2005. And we come out of them on the other side stronger for it. And I think that the same kind of dynamic will occur for us now. These are significant changes, yes, but they also provide an opportunity for us to redefine who we are and rethink our direction going forward. I'd like to close this update with a little bit about our Center for Innovation partnership that we are working on with St. Catherine's University here in St. Paul, Minnesota, and the Presbyterian Homes and Services Organization. The purpose of this partnership is to provide a way of identifying new care models, a way of creating energy around the professional development and opportunities associated with providing senior care. We are so excited about this. We will soon be announcing a multi-million-dollar gift that was given to the partners for support of this center. We also believe that this center will allow us, the partners, to involve our total organizations in innovative practice and new idea generation. It's an exciting time for us, and the multi-million-dollar gift that a gracious donor has decided to fund the transition and the transformation of healthcare in senior care is just a wonderful opportunity for all of us. And we look forward to the learnings from that and being able to apply that across all of Benedictine Health System. In charting our progress several weeks ago, I talked about what does one BHS mean to me based on a survey, a short survey that I did, a little focus group. And it is these 4 things. Number 1, we work for an organization that is faith-based and Catholic-sponsored. That's important to know. 2 is we will work together to solve problems, not to simply accept them as they are. 3rd, the support center's job is to support the communities. The community's job is to support the people we serve. And together, support center and communities, work together to make sure that all of us live fully and live well, both those serving and those being served. We need to, and I do certainly, accept the responsibility and the accountability for the success of BHS. Those are 4 simple statements, but I think they powerfully set the stage for our new era of BHS.
Hello. There are a few more things I'd like to talk about in this video that I think are important and late breaking news. The first is many of you have received an email already from our Marketing and Communications Department about a brand survey that we are doing. Now this is part of a broader effort that we're undertaking to really understand our brand, how we are being perceived by our colleagues in the sector, how we're being perceived by the people we serve, and how we're being perceived by the people serving, hence the survey that you just received. The reality is that if we are going to have this be our new front door, we need to have a precise and concise way of saying, this is who we are, here's what we do, and here's why we do it, and here's what we're hoping to do for you. And it's not just a message that goes out to the people we serve, but those serving as well. And so please, if you haven't already responded to the survey, we would like your input because it is so important for us to make sure that the world understands what the Benedictine health system is all about and what value we can provide to them. The second thing I want to talk about is we've had 4 initiatives that we focused on for 2016. And those are charging for what we do, collecting what we charge, making sure that our resources in labor management are aligned with the census that we are providing services to, the people we're providing services to, and 4th, community transitions. Now we're making progress on all of those, and in fact, because of that work, our financial performance is much better than it would have been otherwise. That's not to say that as fiscal year 2016 ends, we won't continue to focus on these initiatives, but they won't be our primary focus for 2017. Recently, the senior management team and the operating vice presidents came together in a conference to determine what should be our initiatives for 2017. And it's going to inform us as we make decisions about budgets, but it's also going to help us focus our work as we go forward into next year. And there are 4 initiatives that will be replacing the 4 that will fall off the table, if you will. The first is recruitment, onboarding, and retention of associates. We have learned and have heard loud and clear from all of our communities the challenges we face with attracting and retaining good people on our staffs. This is our number 1 issue and one that we want to focus on. And so we will be looking at ways in which we can more effectively, efficiently bring people onto our staffs, bring them into our organizations, and hopefully by doing those 2 things effectively, keeping them for a longer period of time. And so that's real important work that we're doing in our number 1 initiative. Secondly, we need to reduce rehospitalizations. This is so important for us in terms of long-term reimbursement and growth strategies of the organization. We will not receive referrals from the accountable care organizations or our existing referral sources if we are unable to manage rehospitalization rates. Now there's a lot of things that contribute to that, including infections, pressure ulcers, I'll call it failure to thrive, but it's this whole idea of we need to be able to be in a position of assessing folks, the people that we serve, sooner and more quickly so that we can do something that allows them to stay with us rather than have to be transferred back to a hospital. There's a lot of moving parts to that, but Dr. Neil Budenseek and Jerry Reinhardt will be working on that and leading that charge for us. The third is census development. We're still struggling with the phrase that we use to talk about how do we respond to the fact that the markets are shrinking. The markets are going down. If you look at our financial reports for the last several months, what you see is a shortfall, significantly higher than we expected, of short-stay Medicare. So there are choices that are being made by the accountable care organizations to discharge people directly to home or to home with outpatient follow-up or home care rather than utilizing the Medicare benefit for a short-stay Medicare stay in our communities. That's a reality. And so what we need to be thinking about now is how do we capture as much of that opportunity in our communities rather than having them go to our competitors. We can do that when we offer quality services and we can articulate the quality that we provide. And that brings us to the next initiative, and that is decision support and data analytics. We have a tremendous amount of information available to us in our electronic health record Achieve Matrix. We need to be more organized around the way that we pull this information forward, massage it in a way that allows us to communicate to our partners why you want to send your patients to us, because we provide higher levels of care with more consistent outcomes and happier customers at the end of the day. All of that requires an information exchange that we need to focus on. So in summary, our 4 initiatives for the coming year are these. Number 1, focusing on recruitment, onboarding, and retention of associates. Number 2, reducing rehospitalizations. Number 3, growing our census or census development. And number 4, data analytics and decision support. With these new initiatives, I believe that we will be better prepared for the challenges that we're going to face in 2018. And so hopefully you catch the theme here, that there's things we focused on last year to allow us to do better this year. This year we're focusing on a few things that allow us to do better the following year. And that's a process that will continue as BHS marches into a confident future. Thank you.